sequence, we have Dr. Kavita and Pedhe from the Department of Biochemistry, Tata Memorial Hospital, Parel, Mumbai.
Very good afternoon to all of you. Good morning to all of you. Myself Kavita from Mumbai Tata Memorial Hospital. I am working as a scientific officer in Tata Memorial Hospital in Biochemistry department from last 10 years. Today I am going to talk on the topic a case series of Biclonal multiple myeloma which we conducted in our institute. This study has been carried out in Tata Memorial Hospital. Actually, Biclonal multiple myeloma is an abnormal hemoglobins in excess in serum which is known as M proteins or a paraproteins. Biclonal mostly shows two distinct embed which can be shown first at the initial stages or on later on after surgery. Biclonals is a very rare cases. It's occur only 1 to 5% in all multiple myeloma patients. So this study, as I said, it is carried in Tata Memorial Hospital from Jan 2023 to December 23. There was total 7 patients we found out in fully 1 year. It is the diagnostic was done on basis of history, clinical examination, routine blood investigation, skeletal survey, bone marrow aspirations, and its analysis was carried out by serum protein electrophoresis and by immunofixation on hydrolysis. Quantification was done by immunoglobulin level by using nephelometry. So these are the 7 patients, all the histories of the patient. This is the first patient. Age of the patient is 64 years who visited to our institute. He was showing the symptoms like weight loss, since 2 years, chest pain on coughing, abdominal pain, and his UCG levels. Okay, UCG levels is done. Mild perennial collection on right side with few echogenic debris within likely hematoma, bilateral raise, renal echogenicity, is bone marrow aspirations done, and this graph you can see. This patient, all these are the quantification analysis done. As IgM level was 2720 mg per dl and is a kappa level is also 2970. This is the serum protein electrophoresis. The gel vector, it is showing the band in the M region and in the kappa region. Similar, you can see the upper side also electrophoresis. There are two graphs. So I want to say the biclonal cases we show two band. So it has been proved by electrophoresis and immunofixation. Next is the second patient. She is a female, visited to our institute. She was having a fever on and off since 3 months, again weight loss, 6 months, bleeding, piles since 6 months, weakness 2 years, recurrent anemia, thrombosis since 2 months, recurrent oral ulcer, and is electrophoresis and immunofixation showing the data. You can showing this patient is showing the IgM kappa and IgM lambda region. See, there is a band is seen in the kappa region and the lambda region, and this is by electrophoresis, and quantification also see IgM is 10400 mg per and his kappa is 3480. So all the results, quantification and qualitative tests, both are showing that. And this is the third patient. It is a male who visited to our institute. He was having weakness, backache, bilateral lower limb, and then he was showing this system. Then his myeloma studies were carried out. We show again here in electrophoresis, it is IgG kappa. See, he is having IgG kappa, which level is 2460 mg per dl, and his gel also you can see here, that is in kappa region and IgG kappa, this patient. Fourth patient is a 64-year male having bone pain occasionally, weakness since 2-3 months, coughing, diagnosis with multiple myeloma. His stages are second stages. His cytogenetic study found out to be positive, and by electrophoresis he has shown that IgG kappa and kappa light chain only. See IgG, the band is showing in IgG region and in the kappa region. His IgG level is 4250, his kappa is 6180. So the studies are proving by, I just want to say that biconal cases show the two band, and me all 7 patients I founded that by qualitative and quantitative. This is my fifth patient. All the patients are showing that weight loss, back pain, coughing and all. This patient was diagnosed with Wallstrom microglobulin. Electrophoresis carried out. He is showing IgM kappa and IgG kappa. By band you can see that in the gel the band are showing in that region. This is the sixth patient, male, referred to our institute. All the patients are showing the same result like weight loss, fatigue, back pain, leg pain. He is diagnosed with Wallstrom microglobulin, Cumb positive test, hemolytic anemia, and here is also he is showing IgM kappa in beta region and IgG lambda in that gel. You can see there is in the corner that electrophoresis gel in the gamma and beta region, you will see that, and this is the gel which you will find IgM is showing the band and kappa region is also showing the dark band in that region. And its quantification is also IgM is having 1290 and kappa level is also high. And this is the seventh patient, a 52-year male, represented with swelling, difficulty in movement at the shoulder joint since 4 months. Cytogenetic studies was negative, but his electrophoresis study, quantitative and qualitative analysis showing he is having IgG kappa and IgG lambda. You can see there is slightly band in the kappa and lambda region. Okay. So the treatment protocol is given to the patient is all the chemotherapy, different drugs are given to the patient. Radiotherapy was considered for patient with myeloma, for spinal cord compression, pain relief, and for patient with plasmacytoma. So the treatment followed is the chemotherapy and radiotherapy. Chemotherapy is different drugs and the cycles are given according to the patient. And as in our hospital daily we got a patient 30 to 40 patients for serum protein electrophoresis we receive. Among that 5 to 6 are immunofixation. So in 1 year we have found that the 8,000 cases of the patient. Among multiple myeloma 8,000, there are only 7 cases of Biclonal Gammopathy. Till now, all literature has shown that Biclonal cases are only 1 to 5%. So my study also show that it is only 7 cases, means 0.9% still now we are reported as a being Biclonal Gammopathy. During 1 year study, we are found that only 1% cases of Biclonal. So the ages of the patient ranges from 40 to 70 years, mean is 57 years. Among the 7 patients, 6 patients were man and 1 was a woman. We have done immunofixation to confirm. Immunofixation is the confirmation test. Is really they are having 2 band or only single band. So from my study, immunofixation was performed in all cases for the confirmation of the diagnosis of Biclonal Gammopathy, which we concluded based on the presence of 2 distinct bands. And our electrophoresis is also shown 2 bands in all the studies. So all 7 cases revealed 2 M band with distinct isotypes on immunofixation. M band quantification was performed in all cases, showed true Biclonal Gammopathy with M protein of different heavy chain and different light chain. On serum immunofixation, 7 patients have Biclonal band, with most common isotype being IgM kappa, IgM lambda. Among 7 patients, my 2 patients are of IgM kappa, IgM lambda, followed by IgG kappa, IgG lambda, IgM kappa and IgG kappa. IgM kappa and IgG lambda is 1 cases, and IgG kappa and kappa light chain. So in our series, further investigation among patients with biclonal gammopathy show renal insufficiency in one patient, which was related to nephrotic syndrome. This is the chart of my 7 patient, ages, the sex, and this is the diagnostics of the patient and the quantification in the gamma region, beta region, and IFE what I found, and their cytogenetic studies which I have found. This chart elaborate all of the patient which were clinical diagnosed. And the discussion among this study, as I said, it is a very rare cases of multiple myeloma. Instead of single monoclonal band, biclonal gammopathy defined by simultaneous appearance of two distinct monoclonal protein is found. This can result from either an increase of two clonal of plasma cells with each producing an unrelated monoclonal spikes, or form the production of two monoclonal spike by single clonal of plasma cell. Means among this you can have a two distinct band, as my patient was all over showing two distinct band, or one band can district in two. So as the electrophoric picture, no difference in clinical outcome has yet been reported between biclonal and monoclonal gammopathy. There is no distinguish yet had been shown in literature. It is essential to document the baseline serum protein electrophoresis and look out for the further development of any new clonals have been being resistant to first line of therapy. Therefore, appearance of biclonal pattern needs to be followed up more closely. So, conclusion from studies, it is only 1 to 5% of all myeloma. Serum immunofixation increase diagnostic precision and reliability, but also help in monitoring therapeutic response in routine follow-up patient with those conditions. It's also provide to disease pathogenesis and can guide any modification required in treatment. Thank you.
Thank you, Dr. Pedhe.